I wanted to talk about the stresses and the negatives of working in the NHS as a GP. I've seen a slew of negative headlines coming towards general practice and primary care, and that's on a background of generally negative things about the NHS. Could you tell me a bit in your experience about workload?
The main stress or the main kind of pressure that comes in general practice or in primary care in the UK is to do with the time pressure. And it's just the number of patients outweighs the time we have as clinicians, as doctors, as all healthcare professionals in the primary care setting to be able to accommodate, for these patients. Quite often you might find that when you go to a GP surgery, the first thing they say is what one issue, one appointment. And it's simply to do with that aspect, this aspect of time pressure and the sheer kind of load that the clinicians have to deal with. In my personal experience, I love caring for patients, I have a wealth of experience in primary and secondary care. I love applying the clinical knowledge and taking care of my patients, both physically, mentally, socially, whatever kind of aspect is possible. But I do find that, particularly towards the end of the day, you get this kind of burnout fatigue, decision fatigue, because you're making clinical decisions throughout the day. And there is a huge aspect of managing uncertainty in primary care. And to deal with that and the multiple issues that each patient has, and quite often it's complex cases, and patients are living longer as well, which is a good thing, but they need that kind of complex care. So in my opinion, there's a lot of factors and a lot of pressure to deal with in primary care, and it is getting kind of more and more. The workload is building, and that kind of load is having a secondary effect on all people, all clinicians working in primary care.
What is the most number of patients you've seen in a day?
I've seen sort of 18 a session, so that's 36. Plus, you'll see maybe one or two extra emergencies, and then you'll have possibly, if it's a bad day, you'll have like 100 prescriptions to sign off. And apart from that, there's a huge aspect of admin, which is like looking at blood tests, looking at documents, and that's a key aspect. That's a very important, because when you're going patient to patient and then you're seeing numbers on your screen, your brain starts to kind of almost blip out dealing with all these kind of decisions. And sometimes it's that one factor, this patient's, lymphocytes are too low. And if you don't pick that up or, check to repeat that, they could have underlying kind of, blood cancer or hematological cancers or something that you miss, simple things like that, that you can't ignore. And yeah, that's the kind of workload as an experience, but also it shows you kind of the decision fatigue that's involved.
That's something a lot of clinicians talk about, and I think it's been like that since before COVID. COVID obviously greatly exacerbated it and then put stresses and strains on the mental health of healthcare workers in their system already. So this then comes to you're talking about what you're working as now, but let's talk about the system that is supporting all of this and the structures that are holding all of this in place. Where do you think the flaws are in the system that has allowed this to happen, where a clinician like yourself gets decision fatigue and is seeing 40 or more patients a day when the national guidance now suggests clinicians should only see 25 a day?
If I saw 25 patients a day, that would be a good day. I have, I've never seen 25 patients in a day only. Yeah, it's always been at least kind of 30 plus. It comes down to the actual system itself, not recognizing the pressure and not recognizing that there is more and more workload. Plus, as doctors generally, it's not like any other profession. If you see someone in need, by nature as a doctor, you want to help them. So in other words, you're the prime person to take on extra work when you probably shouldn't do, and or you probably should highlight that this is extra work. And before you know it, you're doing a lot more things than you would normally do and burning yourself out. And this is why, GPs don't work 5 days a week. Very rarely do I ever see a GP, even some of the GP partners I have at my practice, none of them work 5 days a week, 4 days maximum. But most people, they want a kind of decent, so 3 days, just because it is exhausting. It takes you a day to recover after you've done a full day of work. So yeah, it's the system not recognizing, and also there is an aspect where, for example, recently we've had a lot of funding going into these ARRS roles. You know, these kind of clinical practitioners, physician associates who are supposed to be supporting primary care, and they do. They have a role in primary care. Then things start to become unsafe. They also don't feel supported in some aspects, or some aspects they do, but they might miss. They haven't had the same degree of rigorous medical training and lengthy process that we've had to go through as doctors, and then prioritizing their funding over kind of the supply of GPs, which happened over the last few months, is gonna have a negative effect. So what we had was more people coming into ARRS roles, but GPs were, especially locum GPs, were sitting at home without any work to do because the funding wasn't there for the practices to employ them. So there's a complete imbalance and in the system itself, and it needs to be recognized and dealt with.
It's a highly dynamic system on every level, and it's been evolving. The targets and goalposts have always been changing. And obviously, you have to tie this back to our political masters, who will
Mm,
then they will follow their own whims for whatever is suitable at the time.
absolutely. No, that's a pleasure. Thank you for having me.